We are live. I'm gonna invite Farm Guide International. Y'all doing? I am going live with Farm Guide International. So we were actually originally on YouTube, but technology, So now we're switching over to Instagram. Hi, Letu. Hi. Hi, guys. How y'all doing? Okay, I think Farm Guide, I hope your audience is public so that we can go live. Otherwise, if it's on private, it will not work. Hi, Samu. Hi, Lele, too. Hi, guys. How are y'all doing on this 1st of June? Hey, new month, new hopes, new dreams, new hustles. I am trying to connect and go live with Farm Guide International. We're supposed to be discussing medicine safety services. Let's try and make that happen. Hi, Marl. Please just hang in tight, guys. We're trying to connect. Yay! Hi.
Hello.
Welcome, welcome.
Thank you. Thank you so
Now, I'm the host.
It's so good to have you. I'm so sorry for all the challenges we've had with technology, not being able to hear you on YouTube. So we can
It
have live
happened.
session on your channel, and then I'll share on YouTube later for my audience. All right. So
Okay, that's fine.
that's fine. Yeah. So my name is Matilda. I'm a pharmacist in Nigeria, and From Patricia is supposed to be my guest, but I'm now on her channel, and anyways, she's still my guest, even if I'm on her channel.
Yeah.
This conversation has to happen, and it's going to happen today. So we're going to be talking about medication safety services, what they are, what are the challenges in offering these services, and how can we overcome those challenges, both as professionals offering these services to our clients. So, from Patricia, you have more. We are all here to learn from you.
Wow. Okay. No pressure. All right. So, first and foremost, thank you for the invite. Thanks, Matilda. It's always a pleasure to collaborate and chit chat with you and your audience. So that's great. But I think I'm just really passionate about sharing my experience. So I want to share that with, everyone who's watching here this evening, that medicine safety is first of all the pharmacist's role, We often like to shove responsibility to everyone else, but our own. So I want to call on all pharmacists out there to please take ownership. This has to become your own personification. You know, when you ask yourself what your profession is, what you do on a daily basis, how do you help patients, medicine safety has to be at the forefront. As pharmacists, we're very used to dispensing, to making medication, to being gatekeepers, but we have to ask ourselves why. The whole purpose of doing anything that we do therapeutic wise is so that the patient would get well based on the medication they take, but within safety parameters. We all know medicine is no different to poison except for dosage, right? The dosage is what makes the difference. And so we have to be so careful to note that dosages have to be extremely accurate. A lot of medicines have narrow therapeutic range, so that means they can quickly become toxic if taken at a slightly above dose than usual or than necessary. And we know that some patients have various comorbidities. Some people have liver issues, kidney issues, and these are the excretory organs, you know, the metabolic organs that help our bodies process these medications. So if someone has liver impairment, renal impairment, you know, if something is wrong with the liver, the kidneys, or any other organ, that already puts that patient at higher risk of medicine issues. So people need to first understand themselves, you know, are you at risk as an individual? Do you need more precaution than the general public? And pharmacists also need to identify that in their patients. You know, it's different how you counsel an 80-year-old than how you'll counsel a 25-year-old. The counseling is so different. So pharmacists need to identify that and really lead with those kinds of differences. But I'm just going all over the place now. I have so much to say on this topic, but I just really want to start with the pharmacist taking ownership and knowing that it is their role. Don't wait on the nurse, don't wait on the doctor, don't wait on the patient to have to say something, to hint. You, as the pharmacist, you have to start with leading with your expertise. And that means don't assume that anyone else knows. Don't assume that they might have been taking this medicine for 6 months, for 6 years, but stop and ask, you know, how do you take your medicine? Has anything changed in the past year or 6 months or however long? Ask those questions. The prescribers that keep repeating same prescriptions every 6 months, ask them, or from the prescription, check, has anything changed in this patient's regimen? So yeah, patient safety is huge. Yeah, patient safety is the pharmacist's role primarily, but patient safety is everyone's business. I think we don't talk about it enough. Patients have become too used to popping pills for the slightest things. I remember when I used to work in retail, people would come in and say, "Oh, I have a cut," or "I have a little, you know, my skin is sore. What can I take? What can I?" And it's like, just toughen up. You don't need to take something for every little symptom. Actually, we're becoming so dependent on medication. We're rushing and running to medicines even when it's not warranted, you
Yeah,
know?
true.
Just toughen it out. Some things just need to pass on their own. You don't need to medicate every single symptom. And the reason I say that goes back to safety because we don't know what these medicines do long term in the body. We know that when patients end up hospitalized with organ failure, it's too late.
Yeah.
But we don't know at what point that organ failure starts and progresses and develops. You know, oftentimes people pop paracetamol like it's sweets, ibuprofen like it's sweets. Every pain, every headache, every little thing, every toothache, they need medicines. Okay, fine, but have you considered what that medicine is doing to your internal tissues?
Mm.
Have you considered ulceration? Have you considered any kind of inflammation or tissue damage or illness deterioration due to medicine that accelerates it or any kind of other thing? People don't think that how safety presents, or people don't think of the consequences of just taking medicines anyhow when it's unwarranted. Um, and how slowly but surely there is side effects, there is adverse events, there are things happening that we don't see, and one day they show up and now it's too late. So and so has ulceration in their digestive tract. They have, uh, you know, liver impairments and other things. So I want to caution people about not taking medicine unless it's absolutely warranted. You have to understand that medicines do have um, good and bad effects, and that you will always be safer taking less than more. Um, so yeah, that's a little bit of my intro. Um, but yeah, I don't know if you have questions you want to go
Yeah, I
through.
do. Do. I
Mhm,
want to touch on something that you mentioned while you were talking. So I know that a lot of people have walked up to me with some conditions. They need you to guide them on what medications to use. And
mhm,
then when you tell them something like, can you wait it out? Like, can we just observe?
mhm,
Maybe take a lot of water, try to rest. People
mhm.
feel like you're not pharmacist enough. If there's
Yeah,
anything like they feel like you're not a professional. You know, they
yeah.
prefer if you prescribe a whole
Go
lot of medications
to
to
them
them,
with 10 things.
see you
Yeah,
at pharmacist.
yeah.
And so I've had that particular challenge ever since I started practicing. I'm not one to load you up with medicines. I try to wait it out. I try to see, is there any non-medicinal solution we can provide to this condition. So I want to
Mhm,
talk about that, especially to non-pharmacists, um, persons who are not healthcare professionals, persons who are actually
mhm,
our patients, because they are the ones who are really in need of, these medication safety services. And while we are offering you medication safety services, you you do not trust in us enough to provide that service. So that has been a challenge for me, and I want you to highlight
mm,
that not all conditions need
mm.
medicine.
Yeah. Ah, it's a can of worms, where to even begin. Patients have been spoiled, to the more developments science has made in identifying new active ingredients, new molecules, now the pharmacy just presents as a shop for everything you need, And I think that kind of subconsciously spoils the patient's mind into thinking surely there's a thing for everything,
Hmm.
you know? And because big pharma, let's not lie, big pharma pushes this agenda, you know?
Yeah.
They want to sell, they want to make more money.
Mhm.
So they will market with brilliance the most unnecessary medicines, you know? And you think, but the patient doesn't need this. You
Mm.
know, many times you find little creams, little syrups, and little throat sprays and lozenges that they're more a placebo than anything else, you know? But patients love that. They love to feel like if I take something, I have done something for myself. I've empowered myself. I've taken action to cure and to heal and to get better. So they love that. And there's consumerism that fuels everything. So in our day and age, it's super difficult. But I would say I always lead with facts, and the patient sees through that and sees the expertise, you know? It's one thing to just say, I think you should wait a few days and see how it goes. That's an unsatisfactory answer to them. They want you to give them something and they want to take something.
Mm.
But how about you say, you know, with my pharmacological expertise, uh, I've weighed the risks versus the benefits of going with this therapy or with this medicine or with this active ingredient. And I believe you will be better off waiting for a few days before you initiate therapy. And then you state your reasons, you know. It might be because the risk of taking this now is bigger than the actual benefit. Maybe because you have this other comorbidity, or you're already taking a very big regimen of 4, 5, 6 medicines, and it's just going to come in and complicate the pharmacotherapy, or it's going to cause contraindications, or it's going to cause whatever the case might be that you've identified. But you have to lead with that because patients suddenly hear these big words, and to them it registers as, oh, you know more, you know better, you're the expert. So I find that it's a play on how you say things that really gets through to patients. But just saying it in a way that's not convincing, like, no, just wait, or you'll be fine, you don't need to take something, it doesn't give them the confidence that they want. So it's all in how you say it. Um, yeah. I've struggled with that too, actually. Patients say, I need something. Give me the best thing. What's the strongest thing? I need to work and I have this headache, or I have this migraine and I need to work. And I say, but have you considered that this is a sign from your body to just say, take a minute and rest? You're actually on the verge of a breakdown. You're on the verge of burnout or whatever it might be. Just take some time, listen to your body. Don't suppress the symptom. Listen to it and yield. So yeah, I always tell them there's two approaches, but using both is good. Using either one is also good. You have non-pharmacological interventions and you have pharmacological interventions. So sometimes you don't need the pharmacological intervention. Sometimes all you need is sleep.
Yeah.
If you're sleep deprived and you have a headache and you're tired and you're grumpy and you're this, don't go looking for an energy drink or an energy shot or an immune booster. Just sleep.
Allow the body to repair itself.
The body knows what it needs and it repairs itself when you are gentle with it and give it a little bit to work with. But there's this massive push from media, from marketing, from big pharma to just always take something. I think it's in the adverts. I can recall now one of these adverts, they've even made sachets on the go painkillers that you don't need to take with water anymore. That's dramatically bad. It's like a little, oh, are you on the run? The advert will even say, like, when you're busy, when you're rushing, on the go, pop this in your bag and just take it as you're going. Like, I'm like, no, guys, no, no, this is so wrong. So it's we're being fed with all the most damaging narratives. And now patients take that. They don't know any better,
Yeah.
you know? So they believe it. They think, oh, I could just pop this while I'm in a taxi on my way to school or to work. But actually, no. What happened to taking a full glass of water? You need this medicine to dissolve into something. If you're
Yeah.
just going to take it dry, then tissue, your uh, gastric tissue might be irritated,
That's
absorption might be hindered or un it might be erratic, if it's not from a solution. I mean,
and it
they're just teaching bad habits to the population.
as well. The drug delivery
Say
may
again?
be too much at once, too concentrated
Mhm.
if you don't take with
Yeah,
water.
yeah, absolutely. So we have to push back and we have to tell the patients, actually, this is this is not the way. And I think fear mongering, I remember at some point I used to use fear tactics, you know because I tell them, well, do you like your kidneys? Do you like your liver? Would you like to keep those organs intact?
Hmm.
you know how much do you care about your kidneys? Let's just take some more water with that medicine, um, how much do you care about your liver? You really should mixing 4, 5, 6 different supplements or medicines or prescriptions together. So I try and, we have to finesse our way into asserting ourselves. Also because I think the public is a bit skeptical. Research shows that your pharmacist is one of the most trusted people in society. I've heard so many research studies saying that people trust their pharmacist for healthcare advice and this and the other. But when you're at the pharmacy counter and you see people's perceptions, people's responses, it
Yeah.
doesn't feel like they trust you. I've had a complete different experience, and it's almost like we always have to defend our stance, and prove ourselves. Patients will ask, but no, my friend said they took this and it helped them, so I want this. But you're like, but your friend is not a pharmacist. Where does your friend get their insight?
That is another
Um,
problem. Relying on their neighbors, their
Neighbors,
friends,
friends, family, over
professionals.
the expert advice. Yeah. So you have to fight and you have to push and you have to assert yourself and say, okay, that's great, but your friend didn't study pharmacology. Your friend might mean well, but they don't have the background necessary to inform this decision. So, and this is where it takes me to, I wanted to differentiate between counseling a patient and advising a patient. We often interchange those two terms, but we also have to be careful because our language really determines our stance, and patients see that, the populations hear that, and then they downplay it. Counsel comes from an authority figure. Counsel comes from an expert. So if you as a pharmacist are speaking to a patient, you have to assume that position of an expert and of counseling, you know? And that is a formal process. But we often use advice and recommend and loose terms that are very informal and that are non-expert. When I give you advice, it's based on my opinion, my preference, and I'm telling you, oh, I think you should do this. So it's an opinion base. But when I counsel you, it's no longer my opinion, It's now evidence-based, it's research-based, it's factual. And it's no longer my opinion. Now it's like science. And I'm telling you, based on the scientific background and my professional authority, to say this is what you should do. So counsel has more weight than advice.
I get
And
you.
counsel lets the patient choose from viable options. You know, you can have multiple treatment options. You can say, okay, you have a sore throat. You can either take an anti-inflammatory, or you can have a spray or a gargle, or perhaps lozenges. If it's painful, you can add a painkiller, or you can just take a numbing or an anesthetic lozenge or spray, whatever the case might be. And then they will pick from those options. But with advice, you don't give them options. You can say, I think you should just use this lozenge. So we need to move away from the informal advice that we so often revert to and give counsel and provide counseling, professional counseling to our patients. I think that also puts a more firm stance on our professional authority.
Yeah. So, okay. So while you were talking, another challenge came to mind. While we are projecting the non-pharmacological interventions, how does this affect you as a business person in pharmacy?
Sorry, say that again. When we address the non-pharmacological.
Yeah, we project the non-pharmacological interventions to our clients. How does
Mhm.
that affect you as a community pharmacist, as a pharmacist in business? Because
Mm.
I believe that the reason why some pharmacists in business prefer to load up their clients with medicines is so that they can make sales.
Yeah, it's always the money. But again, I think that's such a shallow way of thinking, you know? I believe in abundance mindsets. And when pharmacists lead with poverty mindsets, they're always focused on lack and on shortage and on having to hustle to make a sale. But that is low-key deception.
Yeah,
I want to lead with value. Patients will always come back and even buy more from you when you lead with value.
and
They
integrity.
may not make a sale today because you've told them, no, just go gargle with salt water. You don't need this spray. You know, every 2 hours, salt water, make a solution at home, and then you gargle every 2 hours. You'll be fine. Perhaps they were short on cash and they were looking for a means to, treat themselves at home without buying anything. But when you lead with value, that patient will come back themselves. They'll refer their people. Someone helped me at the pharmacy today. You should go there if you have an issue. Or it always comes back in multiple folds. But also, there's other ways of maximizing the patient basket. They have this this way of calling it in South Africa, the basket, the patient basket size, always throwing in more things than none unnecessary just to make an extra sale. But I don't believe in that. If you do the right job the correct way, sales will come. It might not be for the sore throat. Now I missed an opportunity to throw in a painkiller, a throat lozenge, a spray, and whatever else. But how about I do proper preventive health care and I ask that same patient, other than this specific issue, can we look what else you may need. People don't realize you come in for one thing, but a good pharmacist will identify the
all the
root cause. It might be that this person doesn't take immune boosters on a regular basis. Put them on a maintenance immune booster or multivitamin instead. Now their immune system is stronger and now they won't have a sore throat as easily next time. How about you check if they're anemic?
yeah.
One out of two women in South Africa suffer from anemia. That's a huge chunk of the society. So if it's
Mm,
a lady, offer her iron supplements. If it's a man, same. When last did you check your iron levels? And you can help them with the common tests where you press and check the color, you check the inner lids. There's so many ways of quickly checking, but all that is added value. This patient will feel so well cared for. Like, this pharmacist took the time to check, you know, and it makes such a much more of a bigger impact in the long run.
long
Um,
run.
you can even ask this patient, you should come for a screening, or on Saturday it's usually more quiet Saturday mornings, or at this time on a Friday, come back and we'll do some more screenings for you. Encourage them to check themselves for various healthcare issues. Um, you know, that's a cross-selling or add-on, but not just throwing things that are
And then,
basically the same into a basket. That for
mm,
me is just fraudulent. I detest that. Taking advantage of an unsuspecting patient. Like, oh, you feel so bad. Let me now use this to my advantage and give you a ton of stuff that will actually damage you.
yeah.
hmm And at the end of the day, it's not really gonna help that much more. Like we know colds and flus have a lifespan of about 14 days maximum. Most people get over their cold in 7 days. And a
Mm,
cold is caused by a virus.
it
You
is not,
cannot treat the virus.
yeah.
But you'll see all these adverts for treat your cold or reduce your cold, or like lies. Okay, they'll talk about the symptoms, but like if you just sit at home for 7 days, you'll be fine. you know you might want to improve some of the symptoms. If you have a headache, sure. If you have a congested chest or nasal congestion, fine, take a nasal spray or do something. But honestly, it's all to just be more comfortable. It's not to actually treat the virus. So making patients aware of that sometimes also. It goes hand in hand with patient education. We
Yeah.
don't educate our patients enough. They don't leave the pharmacy having learned or known something more than when
Mm,
they came. It's always like, oh, I want this. Oh, what's this? Okay, which one is cheaper? Okay, I'll take this and I go. But you don't stop and say, oh, wait, can I have 60 seconds of your time? I just want to double check this. Are you aware that if you suffer from ulcers, gout, this, then this product is not going to be good for you. It's going to cause inflammation. It's going to cause further issues. Rather, consider this one because this and this and this. Now they've learned something. So
true.
it really makes the difference taking 1 or 2 additional minutes
True.
speaking with the patient. You show your expertise, then they grow trust and confidence in you.
And those,
2, you do screenings, you do preventive health work, you help them to not only treat with the symptoms, but identify root causes. And 3, you suggest more help for them and for their family, like deworming. If they come in for the one child or the one person, you can say, actually, The entire family needs to deworm at the same time. Now you're buying for 6 people or 8 people instead of just for one person. But just because you told them that this is an additional benefit, or, that little communication goes a very long way.
Yeah. So, while I was having my internship, I worked in a community pharmacy, and
Mm,
because of some of the practices, I didn't want to major in community pharmacy. And that was
mm,
how I went to hospital pharmacy and from there to public health pharmacy because of defrauding of clients, and your
mm.
employer
It's
wants
right.
you to load things just so they can make sales. Thank you
Mm,
so much for putting a lot of light on that. So,
mm.
last, what is the place of eating healthy? What is
The
the
place of
place?
eating healthy.
Yeah. We talked about not loading them up with medicines, but
Mm,
also encouraging them to, wait it out. For example, you talked about the virus, the cold and the flu. I
mm,
believe that if they can eat healthy as well, it will also fasten up the
yeah,
rate of
yeah.
healing. And so I feel like pharmacists do not project this enough, like talking to our clients about eating healthy. They
Mm,
just feel like it's just about swallowing
the
pills. You don't
medicine.
care
Yeah.
about how you've been feeding, what you've been feeding your body with, and even
Yeah.
after you're maybe somebody that is um, hypertensive, right?
Mm,
Person has been placed on a daily, like a routine medicine, but the person is
yeah.
still practicing um, unhealthy eating habits. This is not even going to help the medicines to work well. So I want you to talk about eating healthy. How do we infuse this into our counseling without
Mm.
wasting the time of the patient? A lot of them are always in a hurry to leave.
Oh,
So
we're always rushing. Yeah. Yeah. Eating healthy is the bulk of everything, you know? Um, One famous doctor I like to follow on Instagram, he always says, he always says, what you are what you eat, first of all. That's in terms of disease etiology, how a disease begins. Another one always quotes that all disease begins in the gut. So that's your gastrointestinal tract, your microbiota, your good bacteria, bad bacteria, that equilibrium of your flora in your intestine. Um, and I 100% believe that food affects your genetics. Food affects your health. Before we even had medicines, we always had plants and foods. And, old wives' tales, or not homeopathy, what is it? Traditional medicines always pointed to herbs and leaves and fruits and things to go eat in the garden. And our grandmothers always knew how to mix various plants and cause, relief of symptoms and ailments. I mean, food is just the crux of most issues in health nowadays. Metabolic diseases, diabetes, 80% of patients that are diabetic, you'll see that there's diet issues that have caused the condition, especially type 2. Type 1 is obviously fully genetic, but to incorporate that counsel when they come to get their medicine is super important. But again, because we're not taught that at school, we struggle. And I think when it goes back to what I opened with by saying that the role of the pharmacist is to emphasize medicine safety, but also preventive health. And
Yeah.
that comes through food, you know? Show me what you eat, and I'll show you which diseases are coming for you in the next 5 to 10 years. Um, you know, we have to tell the patient, so you've been diagnosed with this or you're taking this medicine now, but how is your diet? Did you know that what you eat also affects your disease progression or your metabolic state or your insulin levels? And it's so many things. Like, we just want to treat the symptom of high blood pressure, like you said. The person's blood pressure is high, but
Mm.
how many doctors will even tell you the cause? They always say it's genetic, it's hereditary. If it was in your family, then it's there. But they never say, oh, perhaps if you exercise, oh, perhaps if you change your diet, you might see great improvements. People have come off medicines after changing their lifestyle, after changing their diets. So, especially when it's early on, I believe that a lot can be done and changed. Um, and just asking the patient, do you know, uh, or just screening them, what is your staple food? What do you eat on a daily basis? And based on what they say, you'll pick up that maybe it's very fatty, or maybe it's very lacking of nutrients or lacking of variety. You can tell them that you're much prone to deficiencies when you don't eat these things or when you exclude a whole food group. A lot of people that are hypertensive also are magnesium deficient.
True.
And it's funny how if you fix the magnesium levels, a lot of people's blood pressures come down. But they don't make that link because Western medicine is geared at medicating people. They're not geared at curing people. So you have to look to functional medicine and to food. So I really believe that the best, purest diets, the societies that eat the best or cleanest, purest diets, most balanced diets are the healthiest. And they don't have as much disease as the processed, highly refined type of societies. So there's definitely a huge link. And yeah, we need to find ways to tell patients because it's only becoming worse and worse.
All right. So it's been a very educative time with you. In conclusion, what would be our take home? Just do a highlight of everything you've talked about. I know you defined what medication safety is as the role of the pharmacist, and you talked about the challenges
Mm.
from the pharmacist to the client's point of view. And now you've also added that if we can pay attention to the diet of our patients as well, we can also help them stay healthy. So I don't know if there's any other thing you want to add, or if you're done with everything you had written out.
Yeah, I mean, I had actually written a lot of um, various services. Look, I have my notes here. I
You
had
can go
written about,
on.
you know, medicine safety services that pharmacists should implement in their pharmacies. Um, Things like medication reviews and regimen optimization. Patients come with prescriptions and we just issue the medicines, but we don't ask, is there anything else you're taking? So, what does a typical day look like? When do you take this one and when do you take that one? And we don't make it a collaborative effect or event, we just tell the patients 1, 3 times a day, go. 1, 2 times a day, go. You know? But at the end of the day, like, it's their health, it's their buy-in. They have to participate. I like to tell patients, or I like to ask patients, to tell me how they take their medicines, because I find that much more effective to correct what they will say than to me telling them what I already know. Because, sometimes it falls on deaf ears. Sometimes patients have selective hearing. Sometimes they'll just say, yeah, yeah, yeah. But when they get home, they forget. So by ensuring that they really know how to take the medicine, I always ask them to tell me how they take it. And suddenly now the roles are reversed. Now they say, oh yeah, did you say it's twice a day? Or I think this one I take in the morning. And now you see them suddenly fumbling and not being so sure anymore. Whereas they would have just said, yeah, okay, yeah, okay. So now it gives them the responsibility they need to have as the patient taking medicine to feel better for their bodies. Now they have to think, okay, this one, it's at 8 in the morning on an empty stomach. Then I wait for 2 hours. Then I take this one after I ate. Then in the afternoon at 1, I take this other one. Then at nighttime at 8, I take this one. Perfect. Now you and them are both sure that the regimen is accurate.
Incorrect. Yeah.
Mhm. So just an encouragement to pharmacists, think outside the box. Sometimes when you get into a routine, it just becomes repetitive, mundane. It becomes too automated, or you lose sight of what you're actually trying to achieve. So just to keep it fresh, keep it educational, keep it expert level, we have all this knowledge, but we hardly ever share it. So letting the patients know, adding value, double checking the regimen, ensuring that what they take is safe for them is what we need to really just emphasize on more.
Thank you very, very much.
Mhm.
I really appreciate it.
Thank you.
Thank you for coming on this conversation with me. I'm going to be inviting you another time because
Yeah, this was fun.
okay, so we're going to work more on what we're going to be talking about next time. But thank you so much for coming. I've learned a lot. I'm sure others that have joined us have also learned. Would make the video available on my YouTube channel as soon as we can. But thank you all so much for
Mhm.
joining us on Instagram. Um, I look forward to having another conversation with you. Do have a blessed day.
Thank you so much. I've enjoyed this invitation, and I do look forward to the next one.
Okay. All
Enjoy the
right.
rest of your day as well. Bye.
Bye.